Hi, Paul Flackis, Good News Broadcast, speaking to Dr. William Gradishar. Hi, doctor, how are you?
I'm well, thank you.
You're with the Northwestern University, and we have Pamela Lipton. Hello, Pamela, how are you?
Hi, fine, thank you.
Good. We're going to talk about metastatic. Did I say it wrong, doctor? Help me out here.
Metastatic.
Okay, metastatic. I don't know, it doesn't, you spell it how? What letters?
M-E-T-A-S-T-A-T-I-C.
Okay, and what does it mean?
Metastatic. And what it represents,
What does it mean? What does that word mean?
It means disease that's spread to distant parts of your body.
Okay. And is it different kinds of disease?
Well, any cancer can be metastatic. The topic today is breast cancer. So it really represents breast cancer that's spread beyond the confines of the local area, meaning the breast and the area under the arm, meaning it could involve the lung, the liver, the brain, any part of the body that's distant from its site of origin.
Is this a common form of cancer?
Well, breast cancer can become metastatic in roughly 30% of patients, and if you think about the population in the United States today with the disease, there are over 100,000 women who currently have metastatic advanced breast cancer that are living among us.
Is this a worldly disease?
Pardon me?
Is it worldly? Is it everybody, women in England and France and in China?
Breast cancer affects women around the world. The incidence in Western countries is higher than in other parts of the world, but as unfortunately other parts of the world start to adopt some of our habits and behaviors, we've seen that the incidence of breast cancer, even in places where traditionally it's low, like Asia, Japan, China, etc., the incidence or frequency of the disease every year is going up. So it is a worldwide problem.
And Pamela, you're a survivor of this type of disease, and congratulations.
Thank you. Yeah, it's more I'm living with it.
Okay, all right. And so you're living with it. When were you diagnosed?
I was diagnosed with metastatic breast cancer 4.5 years ago.
All righty.
And it was 2 months after I was initially diagnosed with what they thought was early breast cancer. But it turned out that when I was about to start chemotherapy 2 months later, they found that I had metastases or lesions all over my liver. So that was considered metastatic breast cancer.
Okay. The first time you were diagnosed, how did that come about? Were you in some pain, and was it a routine mammogram?
It was a routine mammogram. It was a routine mammogram. I have never, in the years that I've been living with cancer, I've never had a symptom of the cancer. I've had symptoms from chemotherapy, but not from cancer.
Okay. And now it's some years later. What would you say to somebody who has been diagnosed with this?
With metastatic breast cancer?
Yes.
I would say that that there is hope, that there are new things coming out and all the time. It's a very scary diagnosis, and it's a very scary thing to be told that you have metastatic breast cancer. When I was told, my doctor called me on the telephone and told me I had 3 years to live. And if at the time, if I'd had somebody to tell me that there was a chance that I'd be able to live longer and live with a good quality of life, I would have appreciated it. So that would be what I would say most of all.
Yeah, that doesn't sound like a nice way to be, delivered a message like that.
Yeah, I don't think there are probably many ways that you could deliver it too well, but it was.
That's probably very true. Doctor, tell us about, is there some good news here?
Well, the therapies for metastatic breast cancer have evolved over the last 20 years, and I think what we can be encouraged by is the underlying science that has really been focused on why a cancer develops, why it progresses, is being understood and applied to how we develop drugs. And as a result, compared to 10 years ago, the number of drugs in development that have the potential for treating many different kinds of cancer, but specifically breast cancer, has expanded greatly. And I think one of the things that we want to raise awareness about is the importance and necessity of women participating in clinical trials, because it's only through that mechanism that new drugs become available to patients and hopefully move the survival beyond what it's limited by in many patients right now, so that we can have women living better, even if it is with the disease, for long periods of time.
How does a woman learn about a clinical trial?
Well, I think they should, number one, ask their own physician what clinical trials are available for their situation. But the second thing they should always do, or at least consider, is possibly a second opinion from a tertiary center. It doesn't mean that they would end up there. It doesn't mean that they necessarily would be treating the disease better. But it gives them an opportunity to see what the options might be beyond what's available where they're being treated locally.
And clinical trials, are they done all over, say, America? Or is it, something that you can physically go to, or do you have to go to? Or what does a clinical trial entail?
Well, clinical trials are of all kinds of shapes and models, so to speak. Some are for advanced disease, some are for earlier stage disease, some are for the development of new drugs or the addition of new drugs to standard therapy. They're generally available anywhere in the United States. There may be certain centers that do one trial, whereas another does not. But clinical trials are available not just at tertiary care centers. They can be offered in a local community hospital or a private practice physician. But I think what one needs to do is to educate themselves and, number one, ask the question about the availability of clinical trials, and then if not satisfied, go to the next step and get a second opinion.
Pamela, how did you get involved even with this outreach that we're doing here today?
I am a member of the Metastatic Breast Cancer Network, and I got involved with them about a year and a half after I was diagnosed. I was looking around for organizations that specifically dealt with metastatic breast cancer, and that's how I got involved with them.
Is that NBCnetwork.org?
Yes, it is.
And so what does an organization like that do?
Well, we try to raise awareness. We want more awareness about metastatic breast cancer, and as Dr. Gradishar's been saying, more research and clinical trials and treatments to extend our lives.
And Doctor, you had mentioned to me also another website called bridgenbc.com. What's on that website?
Well, there was a survey that was conducted actually involving just short of 1,000 women from around the world, really querying them as to what they felt were the unmet needs of patients with metastatic disease, often a population that can feel isolated with relatively few options or resources put towards them. And I think as a result, there's a better understanding now that this is really something that needs to be focused on, not only for the patient's psychological well-being, but for efforts to really improve the outcome of women who have this disease. So the Bridge address that you were given earlier provides information about that survey, as well as links to other places that patients might find useful.
Last quick question. What's good news for you, Doctor?
Pardon me?
What's good news for you in this regard of what we're speaking?
Well, having done this for 20 years, I think what I can say is we've seen an evolution of improvement in the treatment of breast cancer, and specifically metastatic breast cancer. We've seen the introduction of many new therapies that really have helped. That doesn't minimize the problem and challenges we have going forward, but we have a lot of new drugs in development, and I think it's only through an effort of getting everybody involved that we're going to improve the outcome of women with metastatic disease.
Thank you, Doctor, for doing that for 20 years. Last question, Pamela, what's good news for you?
Well, the fact that there are these different treatments in the pipeline that will hopefully extend my life. My goal is to live to be 80, and and I'm counting on these.
I'm counting on 180. Okay.
Thank you.
Thank you both very much for sharing.
Okay,
You're welcome.
thank you.